Hi, I'm Joanna, and I'm a physical therapist assistant student at Carroll Community College.
Hello, my name's Erica, and I'm also a physical therapist assistant student at Carroll Community College. Today we're going to be discussing cranial nerve 12, the hypoglossal nerve. We'll be briefly describing the anatomy, the different types of lesions that can occur in the hypoglossal nerve area, and some clinical tests that we can do to test the hypoglossal nerve.
Okay, first we are going to talk about the hypoglossal nerve and where it actually is. So the cell bodies of the hypoglossal nerve are located in the hypoglossal nucleus of the medulla, which is right in here. The nuclei are in the dorsal medial medulla, as said before. The fibers then run together and they form and go into the canal, the hypoglossal canal. Next, they branch off and they head to the different muscles, extrinsic and intrinsic muscles of the tongue. Next, we're going to talk about the different muscles of the tongue. First of all, there are intrinsic muscles. There are many of them. But we're going to talk and focus on the extrinsic muscles of the tongue. We have the genohyoides, which is a part of the genoglossus. So down here, it's just more the inferior fibers. So the genioglossus and the genohyoides together, the inferior fibers, again the genohyoides, protrude the tongue, the middle fibers depress the tongue, and the superior fibers draw the tip back and down. Next, the hypoglossus, which is right here in the green. Its function is to depress and retract the tongue. The styloglossus, here in the purple, its function is to retract and elevate the tongue. Now, not pictured is the paleotoglossus, which is not innervated by the hypoglossal nerve, but it is an extrinsic muscle of the tongue. The activity of the hypoglossal nerve is controlled by both voluntary and reflexive neural circuits.
There are two types of lesions that can affect the muscles of the hypoglossal nerve. The first type of lesion is called an infranuclear lesion. This occurs in the lower motor neuron, so it's actually occurring in the hypoglossal nerve. A infranuclear lesion causes paralysis, atrophy, and fasciculations on the tongue. The top picture here shows a person that has an infranuclear lesion. You can see how the tongue points towards the affected side of the tongue when they stick it out of the mouth, and here are the fasciculations, these little wrinkles here. The other type of lesion that can affect the muscles of the hypoglossal nerve is a supranuclear lesion. This lesion is going to actually occur in the cortex as opposed to being in the hypoglossal nerve itself. Some things that may cause lesions in the hypoglossal nerve area are tumors, meningitis, or polio. There are a few tests that we can do to see if there's a problem with the hypoglossal nerve. In the first test, I'm going to have my patient push her tongue to the sides of her mouth. I'm going to feel how strong that is. If her tongue is weak, I'll easily be able to push it away from the side of her mouth. If that does occur, that's a positive test, and that does show that there may be something wrong with the hypoglossal nerve. Another test that we can do is to simply have Joanna stick her tongue out. If Joanna was experiencing hypoglossal nerve damage, her tongue would curve to the affected side, and we would see fasciculations and atrophy on the same side of the tongue as the way it's curling. If Joanna's tongue curled to the opposite side of the fasciculations and atrophy, this would indicate that the problem was not in the hypoglossal nerve, but in the cortex instead.
The next test we could do would be to have our patient say la la.
La, la.
If the patient could not say la la, this would indicate a problem with pronunciation, and that is also indicative of a problem with the hypoglossal nerve because the hypoglossal nerve innervates the intrinsic, fine motor, and the extrinsic muscles of the tongue, which help us to pronunciate and articulate.